Welcome to the body imaging cases. This is an 18-year-old male with fever. The CT showed focal liver lesions consistent in view of the fever with liver abscess. Ultrasound was also consistent with liver abscess. The lesion has more solid components than cystic components. This is well known in the early liver abscess. The point here is that this ultrasound has been done quite a good time after the onset of fever, and the abscess is still having more solid components than fluid components. Ultrasound guided drainage of the abscess has been done, and it yielded a very small amount of pus. Based on the purulent material taken from the lesion, the diagnosis of abscess is established. However, the scanty amount of pus which could be drained and the rather solid appearance of the lesion posed a certain question mark. PET-CT has been performed. And it shows the drainage tube within a lesion which looks quite solid. The answer came from the history, the past history of the patient. This has been a well-known case of chronic granulomatous disease. Chronic granulomatous disease is a rare genetic disease in which phagocytes are defective, and therefore the body is quite vulnerable to bacterial and fungal infection. At the age of 6 years, this patient had brain lesions. Of importance in this unenhanced CT is the hyperdense nature of this lesion here, which proved later to be aspergillus abscess. The abscesses are dark on T2 weighted images and solid and enhancing on contrast enhanced T1 weighted images. At the same time, the patient had an opacity of the left lung apex, and the bone scan performed at that time showed that the rib is also involved. And the histopathological diagnosis of the rib lesion, the lung lesion, and the brain lesions was aspergillosis. In the same year, the patient had a solid abscess of aspergillosis in the muscles of the back. 2015, the patient had pyogenic infection of the inguinal lymph nodes, and MRI at that time showed that the infection is quite deep, involving also the right side of the pelvic cavity. 2016, the patient had pyogenic infection of the right submandibular lymph nodes. 2017, the patient had a liver abscess. This liver abscess has been at segment 7. It took this abscess a long time under treatment to be liquefied, but subsequently it has opened into the base of the right lung, forming a lung abscess. The lung abscess has been drained. And the liver abscess has also been drained. And here is a 3D representation of the two catheters. What was done here is that contrast agent encoded in red has been injected in one of the draining catheters to see if the two abscesses in the lung and the liver are intercommunicating. They were intercommunicating. The lung abscess healed first. The liver abscess has been still drained at that time, subsequently healed. What is peculiar about the abscesses in chronic granulomatous disease is that they take long time to heal, long time to liquefy. 2021, the patient had again lymph node infection, pyogenic lymph node infection of the lymph nodes of the left side of the neck, treated appropriately. Then the patient had the abscess we are talking about in this presentation. The message here is that due to the poor phagocytosis, liquefaction of the abscess takes longer, and therefore drainage, which is the mainstay of the treatment of the abscess, may be a little bit postponed. So this is the first modification one can do in a case of a chronic granulomatous disease if there is an abscess. The second point is to use corticosteroids. Corticosteroids are important part of the management of the liver abscess in patients with chronic granulomatous disease. The third modification you may resort to is surgery. And some authors advocate that it's better to go for surgery from the start instead of waiting for a long time for the drainage, antibiotics, and corticosteroids to manage the abscess. However, the argument against that is that these patients may have repeatedly liver abscesses, and the loss of liver volume by surgery may not be a good thing there. This patient illustrates very well this argument because the first abscess has been in segment 7, already healed, but the segment 7 is preserved, and now the second abscess is in segment 8. Diagnosis is liver abscess in chronic granulomatous disease. Chronic granulomatous disease is a rare genetic disease in which phagocytes are defective, and therefore the body is vulnerable to bacterial and fungal infections. Liver abscess in chronic granulomatous disease tends to be more solid, more difficult to drain, more likely to get complicated, and slower to heal. Two treatment options may be thought of in case of liver abscess, which are not resorted to in the liver abscess in a previously normal patient. These are the corticosteroids and the surgery.